Welcome to online teaching program. Graphicra Hill University, Dehradun presents this online teaching program. School of Pharmacy presents this session for the medicinal chemistry, and we will continue for the drugs for parasympathetic nervous system. Today is part 3. I'm Associate Professor Dr. Ahmad Nawaz from School of Pharmacy. So first, have a look on the previous class. So we have done the synthesis of the acetylcholine, and in the synthesis of acetylcholine, we done that after the glycolysis, the acetylcholine is formed when the choline, which is a precursor, and this choline basically is after the biosynthesis from the serine, this choline is formed, and then with the acetyl coenzyme A, in presence of choline acetyl transferase, the acetylcholine is formed, and then it is stored into the vesicles, and by the process of exocytosis it comes out of the presynaptic or means preganglionic nerve. And then after, where there is an enzyme which is acetylcholinesterase, and that hydrolyzes the acetylcholine into choline and acetate. We have seen that this acetylcholine has number of activities on the receptors. We have done the receptors in the last slide, that there are nicotinic receptors and muscarinic receptors, and the activities of this acetylcholine is slowing down the heartbeat and increasing the intestine activity, stomach activity, contraction of the pupil, etc. The storage of the acetylcholine is in the synaptic vesicle, and it released in the form of the quanta. And these are the parasympathetic sympathetic stimulation. That's why the acetylcholine is known as parasympathomimetic agent. Now, in one of the slides we have done the neurotransmitters. Basically, acetylcholine is the most abundant or most widely spread neurotransmitter throughout the body. And there are four category of the neurotransmitter in the bodies. One is the acetylcholine, the second is biogenic amines, and the second is excitatory amino acids, which is gamma aminobutyric acid, and neuropeptide, which is GALP, galanine-like peptides. And there are around 50 known neuropeptides are there, and these indolamines and catecholamines. You might aware about the catecholamines because we have discussed this catecholamines category in the previous unit, and this is the class where the dopamine, norepinephrine, epinephrine, and they are synthesized from the tyrosine. The indolamine, the class contain the serotonin, tryptamine, and which are basically synthesized from the tryptophans. So this was the previous session which we covered, and then we started the cholinergic receptors. Okay, muscarinic and nicotinic receptors. So before we go further, we should know that why the muscarinic and nicotinic receptors they are named so. Muscarinic, which comes from the word muscarine, and the muscarine is a compound. It's a toxic alkaloid which found in the fly fungus and mushroom, and it was the first compound which was used to check the activity in the parasympathetic nervous system. It contained a moiety which is known as the tetrahydrofuran, which also known as oxalate, and this was the compound which, when it was tested, and it showed its activity in different location in the body. So those locations then they are known as the muscarinic receptor, because the muscarine they act on those locations, and there are 5 in numbers: M1, M2, M3, M4 and M5. We will discuss them later. There is an also quaternary ammonium group like in the acetylcholine, and there is an also quaternary ammonium group. That's why the acetylcholine is a agonist of the muscarine, and the pilocarpine, as it also contain this tetrahydrofuran group, So it's also an agonist of the muscarine. So that's why it is known as the muscarinic receptors. Now the nicotinic receptors. Nicotinic comes from the nicotine. You might aware about the nicotine. It is found in the tobacco, and this nicotine, it is of two moieties. There are two moieties. One is the pyridine ring. This is the pyridine ring, and this is the pyridine ring. And this is the lobeline, which is work as an agonist of the nicotine. And there are two receptors on which they work. Nicotine, because it was when it was first tested, those locations on which the nicotine act, and those locations were termed as, since then those locations were termed as the nicotinic receptors, and there are two in numbers, N1 and N2. We will discuss them in the coming slides. Nicotinic receptors. Nicotinic receptors are of two types, N1 and N2. This N1 is also known as NM because it is on the skeletal muscles, so it is known as NM. And N2 is also known as NN because it is on the ganglionic cells. That's why it is known as NN. Now the N1 nicotinic receptors, they are located on the skeletal muscles and they cause the contraction of the muscles as an agonist. So agonist basically which works as same as the nicotine. So they are the phenyl trimethyl ammonium. This is phenyl trimethyl ammonium, and there is an antagonist for this which is known as tubocurarine. This is the structure of the tubocurarine, and this tubocurarine basically sets toxic alkaloids, and earlier it was used as an anesthetics, and now it has no more means it's very rarely used as an anesthetic because more safer anesthetics are available in the market like rocuronium. This is N2 and also known as NN, located on the ganglionic cells, adrenal medullary cells, in spinal cord and in certain areas of the brain. As an agonist, dimethyl phenylpiperazine. This is dimethyl phenylpiperazine, which is an agonist for the nicotinic receptor 2. And hexamethonium. This is the hexamethonium, which work as an antagonist of these agonists. Now the muscarinic receptors. These muscarinic receptors, they are of 5 types: M1, M2, M3, M4 and M5. These muscarinic receptors, they are located in different locations. Just like the muscarinic receptor 1, it is located in exocrine gland and central nervous system. The agonist which works as an acetylcholine, this is acetylcholine agonist, which is cevimeline and xanomeline. The antagonist is pyrazine. These agonists, they works to mediate the excitatory effects and also increase the gastric and acid secretion. Now M2, muscarinic receptor 2, it is located on heart and the agonist is methacholine. Antagonist is atropine. This agonist methacholine, it works to mediate the olfactory behavior as well as it works on the heart. Now M3, it is located on smooth muscles, brain, endocrine gland, exocrine gland and lungs and pancreas. The agonist is the bethanocol. Why I am saying agonist again and again? Because it is the agonist of, these are all agonists for the acetylcholine, right? So acetylcholine, these are the agonists of acetylcholine. These are antagonists of all acetylcholine and as well as these drugs, these agonist drugs. So agonist is bethanocol and the antagonist is hyoscyamin and atropine. These agonists, they works to regulate the insulin homeostasis as well as glucose homeostasis. Now M4, in muscarinic receptor 4, they are located in the cerebral cortex and hippocampus. The agonists are the carbacols and antagonist is dicloverine. This agonist, it works to inhibit the autoreceptor acetylcholine. Now in M5, they are located on central and peripheral nervous system, but they are not much explored. Anyway, the agonist for this is sabocameline and antagonist is xanomeline. This sabcomaline, it works as an acetylcholine, but they are not fully explored. So that's why very few activities are known for this receptor. Very interesting thing. I'm not contradicting with my thing. Just like I said that on the M1 there is an agonist, this xanomeline, and here is an antagonist, is xanomeline. This is the exception where this xanomeline is a agonist for M1 and also for the M3, but it is the antagonist for the M5. Actually, the M4 behaves like same as M2, while the M5 behaves like M3 and M1. Now the selectivity and non-selectivity. What does this selectivity means and non-selectivity means? You may heard the terminology competitive and non-competitive, direct and indirect, because when we will do the classification, we will use these terminologies: selective compounds, non-selective compounds, or selective agonist, non-selective agonist, and competitive agonist, non-competitive agonist, direct acting, indirect acting. This selective agonist or selectivity is basically the degree to which a drug acts on a given site relative to other sites. However, non-selective affect many different tissues or organs. So that's why if it is for a particular site, it is a selective. If it is goes to on different tissues and different sites, then it is non-selective. The direct and indirect means that I'm taking the example of in the parasympathetic context, that direct acting parasympathomimetics is the one which bind directly to the cholinergic receptors, while in case when it inhibit the acetylcholinesterase, which is used to hydrolyze the acetylcholine when it comes into the synapse after the presynaptic or preganglionic nerve, then it is indirect acting. They work on the acetylcholinesterase, acetylcholinesterase, and then the acetylcholinesterase will not hydrolyze the acetylcholine, so it is known as indirect acting inhibitor of acetylcholinesterase. This is just an example which I showed that how the selective and non-selective works. For example, this is the site, and these are the chemical which can bind to the site, and these are the receptors. So these chemicals, they are basically the selective. If for example for this is a different site, and if the same chemical they come and bind here, these chemicals, so they will be a non-selective. If they works for only this receptor or only this receptor, then these are known as selective agonist or antagonist, whatever their activity is, based on whatever activity is there. And if they works also on this site, then they will become non-selective, because they work here and here also. Now, before we go on the acetylcholine and some structural activity relationship of acetylcholine and the other drugs, we have to know that what are the acetylcholine activation in the parasympathetic system, what are the effects. So in the cardiovascular system, as we have already done in the previous slides, just have a look on these effects. The heart rate decrease, velocity of conduction decrease, blood pressure decrease. In respiratory system, the bronchoconstriction increase, means the constriction of the air passage. In gastrointestinal tract, gastrointestinal motility and the peristalsis increases. We have already discussed this, that there is a stomach and intestine activity increases. Urinary tract increase the contraction of the ureter and the bladder smooth muscles. Eye contraction increases of the ciliary muscles in the iris, means in the pupil. The secretion, number of secretion they get increase. Salivation increase, lacrimation increase, gastrointestinal secretion increase, bronchial secretion increase, and sweating increase. These are the parasympathomimetic. I am talking about the mimetic. In the parasympathetic nervous system. Now we will talk about the cholinergic antagonist. So we will discuss these antagonists when we will start cover the antagonist. So, we will cover up these antagonists later on in the coming classes. Thank you.